Not yet, not yet, not yet. Pause recording. Trying to record this. There it is. I'm going to, so make sure you fill out that invitation from me and SurveyMonkey. It basically indicates to us that you participated in this HIPAA presentation and infection control. So I'm going to turn it over to Brenda. Brenda, if you're ready, I'm going to make you the host now. Okay, Brenda, you are our host.
Okay, hello everybody. I miss seeing you in person. Luckily, we have this technology that can help us connect until we get until we resolve this COVID crisis. So just briefly, mostly what I wanted to do today was really thank you. I know it is really challenging to cope with what's happening in the world right now, to come to work, to care for our clients and patients. And I just really want to thank you for being here for each other, for our patients and for our community. And really remind you how important self-care is during these times, and encourage you to talk to your friends, your family, your significant others about how to create really a self-care plan during these times, because these are unique and difficult times. So I just want to share a little bit of, let's see, share, there we go, share my screen. Can you see that?
No.
Yes.
Go back.
I don't see anything. I mean, I see your desktop.
Okay.
I see your desktop.
My
there it is.
desktop, my crowded desktop. Okay.
Now it's it.
Oh,
Now we see it.
you see it?
Yes.
Okay. Well, you know, all I wanted to point out was initially when we started with this, we really thought we had a little sprint, right? That we needed to really garner some energy and address the 2 weeks that initially the mayor had told us that we needed to shelter in. And this has really turned into a marathon, right? And one of the differences between a sprint and a marathon is in a sprint, you put all your energy all out, right, to reach the goal. But in a marathon, you need to conserve your energy so that we can get to the end of the goal, which is to get past this COVID-19 pandemic. You know, I am hopeful when I see countries like China, South Korea, Italy, Spain, right, who were able to address the surges of the epidemic and are now, I think, really on the road to recovery, both health-wise and economically. Wanted to share a little bit of what's happening in San Francisco. We actually, in San Francisco, 221,581 tests that have been provided. So that's potentially up to like 20% of the San Francisco population. This specifically that you see the data in the screen? Yes?
Yes.
Yes. It's the positive cases, and this is as of yesterday. So 5,363 people who've been identified as being COVID positive. You can see the data in terms of gender. So more males and females. In terms of age group, and this is important for us to know, you can see that the bigger numbers are really between the 18 and 40-year-old, right? So we all know that, you know, the older you are, the more vulnerable. But what we're also seeing is that the increased cases really are among the younger population. So this is a message for our young people that they also need to be careful, and they also need to take the precautions that are needed. If we look at race and ethnicity, in terms of the positive cases, you can see that the Latino community has really a disproportionate share of positive cases. And as we know, that is in large part because many in the Latino community are essential workers. Many of them live in sort of multi-family and crowded conditions. Many are not connected to healthcare. So we're seeing really a significant disparity in the number of Latinos who test positive for the virus. And you can see the data for other communities here. I say the other larger group are the Caucasians and then Asians at 10%. The bulk of the cases is through community contact. So they're getting it somewhere out in the community. Let's see, next slide are deaths. So we have had 53 deaths due to COVID in San Francisco. One of the things that gets monitored is the amount of hospital beds, just to ensure that we have capacity to take care of those who become ill. When we look at deaths, again, more males than females. And in here you can see really a disproportionate number of the people who died due to COVID are older, over 60 years old. The Asian community is the most highly affected in the number of deaths, as you can see in the data, although the numbers at 53 are kind of small. So that's just a little bit of information in terms of what's happening in San Francisco. This data is actually available daily by the department, through the Department of Public Health. I also think we need to be very proud about the response that we have done. In response to COVID, we have done a lot of prevention activities and going out and doing education through community outreach. We have done postings in our Facebook. We also, Sabrina has done several radio presentations in Spanish radio.
I just send the referral then.
In testing, we have had almost 2,000 tests that we have administered to date, and kudos actually to the prevention staff that has been doing a lot of that work, and also our testing team has really been very diligent in trying to create good access to our community to testing. Of the people we have tested, about close to 15% have had a positive result. And not surprisingly, the majority of those who have tested positive are from the Latino community. We are also concurrently to doing all this testing, really starting to open up our primary care and behavioral health. We're still doing a good number of visits, but are also increasing some of the face-to-face visits for patients. We also started virtual visits, so I think we've had one visit today. Dr. Ruiz actually was able to get audio and video with patients, their cell phones, so we expect we'll be seeing more of those as we get the technology in place. And one of the important things is really opening for preventative screening. So what we have heard, for example, is that there is concern that the number of deaths due to cancer might increase because there's not enough preventative screenings happening, so that the disease cannot be identified earlier and then treatment be instituted. So these concerns, if people stay out of primary care for too long, if we stop the preventative screening for too long, it can have some negative consequences. Another important source of information is that at San Francisco General Hospital, Ward 86, the number of patients with undetectable viral load actually fell by 1/3. And it's felt that part of that is really the less access to primary care and to being engaged in care that these patients were engaged in. So all of that to say that primary care is important, and we will continue to provide it both through telehealth and face-to-face visits. In the same way, I think we continue our access for behavioral health. I think as time passes, a lot of our patients are very stressed by the current situation. And thank you to all of the staff, because I know everybody has really put in an effort to try to reach out and help our community in many ways, both in terms of examples of those are getting food vouchers that we can sort of provide our patients. So that's all the messaging I have. Thank you again, and I'll stop sharing and get back to Joni. So Joni, how do I give you the screen back?
You got it. Oh, okay, I'm gonna move it over to Fernando, if I can find you, Fernando. Oh God, there's 100 participants here. This is really awesome. Where the heck are you, Fernando?
Right there.
Okay. Sorry.
Can you hear us?
Do you have your screen on, Fernando?
Yes.
Oh, there you are. Okay, I'm so sorry. I couldn't find you.
I'm your next door neighbor.
I know. Brenda, could you move it over to me as the host? Or move it over to Fernando?
Go to the top right corner, right-hand corner on the three dots. You can give somebody else the right.
Can you?
Just move it to Fernando. That would be the easiest.
No, she has to let us in first.
Okay, Fernando, you're now the host. You can share your screen.
Okay.
Thank you, guys.
Yes.
Okay, and can you put it in?
You want me to put it?
What do you call it, in position? The view. Presentation. Hold on a second. Slideshow. It's slideshow. There we go. Okay, everyone. Welcome, everyone. This is our annual HIPAA review, privacy and security. Oh my God, security training. I know that many of you did the SFDPH training, which is very extensive and long. This is a short version of that. And as Joni mentioned, what we will be doing is pretty much have a short survey, 5 simple questions. Most of them are true or false. So if you can do that afterwards, that would be great, okay? So then the first part is gonna be done by Yojani. Take it away, Yojani.
Ooh, thank you. So hello there. First and foremost, we should review what HIPAA is. All of MNHC employees, we should all be aware what HIPAA is. So HIPAA is the Health Insurance Portability and Protection Act. This act, established in 1996, is a federal privacy law. It protects patient privacy, and it allows the sharing of health information for the purposes of TPO. You may be wondering, what is TPO, Yojani? Remind me. Well, TPO stands for Treatment, Payment, and Operations. So treatment could be medical or behavioral health care treatment. Payment, we could do billing or insurance processing, and operations is care coordination, quality management, etc. So these 2 laws are important, but all laws are important, right? So we have a few other ones that are pretty important to our facility. So HIPAA, of course, we just went over it, is the most well-known law governing healthcare privacy. You also have HITECH Act, which is a federal law that sets privacy and security requirements for electronic health records. We are all aware of EHR that we use. Last but not least, we also have the California Medical Information Act, which is a state law, and it protects patient privacy, excuse me. And once more, we want to remind you all that all laws are important to know. So PHI is the protected health information, and PHI consists of information that can be individually identified as belonging to a particular person, whether they're dead or alive. They're still important. And some of these PHIs are personal identifiers, such as a name, a medical record number, among others. Health status, care received, payment of services, and demographics such as age, gender, zip code, etc. So this protects patients, and it protects them in, it applies all types of communications, right? So it could be verbal, whether you spoke to someone, paper documentation if a provider wrote it down, or electronic data if you sent a secure email or not secure email. You can always, oh, sorry about that. You can only access PHI when necessary to your job. And with that, we segue to policies and procedures. So MNHC has policies and procedures to protect the privacy information. Sorry about that. You can find them in Policy Tech. If you have not checked it out, we have everything that has to do with all the policies right there for MNHC. So check it out when you have some time. You are responsible to follow these policies and procedures to protect the privacy and security of information. So we all know NextGen, I2I Tracks, Epic, CareLink, Cover California, et cetera, et cetera. Employees are only authorized to access information necessary to their jobs. Once again, all employees or volunteers or contracted staff that have access to, use, or disclose PHI must comply with HIPAA.
Now it's good.
Oh, it is me. So the reason why we need to comply with policies is because we have random audit of access in MNHC. If you have any sort of question or need guidance, don't be afraid to reach out to your supervisor or manager. Employees must contact the privacy officer, Fernando, immediately if you suspect a privacy has been compromised. So don't wait, do it immediately. And then need to know and minimum necessary. This is really important because information that can be shared should only be the information needed for someone to do their job. So you need to share information only with those that have a need to know to do their job in caring for the patient. Use the minimum necessary information you need to perform your job. So if you see the picture at the right, you can see all of the patient's entire medical history. That's a lot. But what you actually need to perform your duty is just one file. Could be that one file, could be more, but I think that's a visual representation of what I'm trying to get at.
So now it's my turn. We're going to continue with need to know and minimum necessary. As mentioned, we can share the minimum necessary information with those that have a need to know, but once again, for the purposes of TP, which is treatment, payment, or operations. And these are some examples. Diagnosis and treatment, hint, hint, that's medical or behavioral health. Referrals, coordination of healthcare with any provider. Once again, it could be referrals. It could be with other people within the institution or any discipline who has a medical or psychological responsibility for the client. And this is an example. Staff only need access to demographic and insurance information of a patient. That's it, basically. Medical providers, they have access to the medical record, and that would be it, basically. In terms of accessing PHI, Protected health information that is needed for TPO and minimum necessary. In terms of that access, there is something that is called snooping. It's the deliberate looking at a file. It could be a medical record that is not part of your work. And snooping is considered a serious violation and is punished with termination. And here's an example. Many of you remember Jesse Smollett. He had an incident in Chicago. Well, about 36 people at the hospital where he went. I hate to say it, these were mostly administrative staff and medical assistant started snooping in the medical records. And what ended up happening is all those 36 people got fired. I don't know about any litigation yet, but what did happen is that because these 36 people were snooping into the medical record and they had no business doing that, they got fired, all of them basically. In terms of data security, which is very important, only the respecting the privacy of our patient and our client's information, but also general data security. As staff, we are required to follow the health center's data security policies. Once again, you can find this in Policy Tech. All access attempt to databases, not only the Department of Homelessness and Supportive Housing, which is changes, for instance. Actually, it's the Human Service Agency that manages changes. HIPPA is managed by the California Department of Public Health. They're subject to monitoring, recording, reporting, auditing, and penalties if unauthorized uses are encountered. And these are some reminders that we should think about. We need to log off anytime you leave your computer unattended. Do not allow others to use your computer under your logon or your, in other words, your password. Place your monitor so it cannot be read by unauthorized persons. Be present at the fax and printer when documents print out. When you discard documents with PHI, you put them in or come here upstairs to the shredder. Never recycle documents with PHI or reuse to save paper. I know that we love to save trees, but we cannot recycle documents that have PHI contained. And this is very important, and we've had lots of conversations in the past about this. We should never send the name of a patient or any identifiable information of a client or patient in the subject line of an email. Rather, we have a new mechanism to encrypt it. It is writing the word secure 2 dots. If you put secure in 2 dots, and then you don't even need to write the name of the person, it automatically gets encrypted in the email. That's a new feature that we have with our email system. Here's other data security regarding portable and electronic devices. Funding sources such as the Department of Public Health prohibit expressly that PHI, that patient data, is held in privately owned portable devices, be it cell phones, flash drives, memory sticks, and laptops. The only way that we can use it is that if it's issued by MNHC, which are encrypted, or a laptop that is encrypted. Our portable devices that are issued by Mission Neighborhood Health Center are encrypted. It says be encrypted. When a person is traveling, we have to keep these portable devices with us at all times and guard against theft or loss. If there's a loss of any device with PHI and it's not encrypted, or even if it's encrypted, this is a reportable privacy breach. Even if it happens in another state or another city. If a privacy breach occurs, you must report it immediately to su servidor, Fernando Gómez Benítez, at extension 2200. 08. Talking in public areas, because we have had complaints sometimes, is that we have to remember that people can overhear what we talk about. We have to refrain from discussing patient or client information in public areas, such as hallways, the elevator, in the reception area, and public spaces. And the good rule of thumb is to discuss PHI in a private area, such as your office or an exam room, and remember to close the door when discussing this. And last but not least is the use of social media. When you participate in a personal blog on social or in social media, we have to remember the following: never to share any client information, excuse me, or share details of a client situation that you have experienced from your work. If you've been here for a few years, I've explained of a case of a doctor that was talking about a patient, and several patients knew who this doctor was talking about, and this doctor was terminated. Actually, this was in a federal qualified health center. Never post pictures of clients or patients. And for that, I'm gonna explain very briefly. At Texas Children's Hospital, a nurse, she posted details of a patient condition on her Facebook group. It was a pediatric patient with measles. She did not disclose the name of the patient. She disclosed, but she did disclose a picture of the patient. And she was talking about, you know, she understands why parents want to vaccinate their kids. It was an anti-vax social group. And what ended up happening is that while she did not include the child's name, her Facebook profile listed where she worked. One parent in the group had a child at the same hospital, worried about the exposure to the disease. Parent posted screenshots to the hospital's Facebook page, and what ended up happening is that the hospital had to launch an investigation and immediately suspended the nurse. And after that investigation, did delete her comments. The hospital ended up terminating her. So then that's very important that we try to avoid not even talking about our work, specific work in social media. We should remember that posting client information or sharing details of clients can result in privacy violations, which may be subject to disciplinary action, individual fines, which are very hefty, and also the institution receives these type of fines, and professional sanctions, which could also happen. So what are we talking about when we talk about social media? Twitter, Instagram, Facebook, YouTube, and as of now, TikTok, etc. If you guys have any questions, that would be our presentation. No questions?
No.
Okay, last but not
Fernando or Yojani, can you transfer this over the hosting to Stephanie now, please?
Of course. Oops. This isn't going. Who do you want me to send it to? To you?
no, Steph.
Oh, sorry.
Could you do the hosting to Stephanie Furtado, please?
For sure.
Thank you.
Oh, share. Okay. There it is. Where's Stephanie?
You have to go down.
Oh, there she is. Okay. So let's make host. Yes. Steph, you're up. Thank you all.
Yojani, nice job, you guys. Okay. All right. So, hi everyone. This is Stephanie Furtado, Director of Clinical Operations. I will be reviewing. Oh, what the heck? I will be reviewing, or doing our annual infection control review. Let me just make sure my screen so everyone can see it. I'm gonna mute everyone, but you'll have the option to unmute yourself. And if you have any questions, please type them into the chat box and then I'll get to them as we go, or I will answer questions at the end. And do we have Elizabeth on the call? Okay.
Elizabeth's on vacation.
Oh, she is. Huh. Okay. All right. Thanks, Henry. So let me go ahead and share my screen. Okay. Just get the chat up. All right. I think I have the rest of the time, but I do not want to take the full amount of time. So can everyone see my screen now?
Yes.
Okay, good. All right, so Jaime, I may have you chime in on some clinical items, but basically this, we do an annual infection control review. We do have a very long, about 75-page infection control manual that is broken down into certain sections. So because infection control is a very wide array of different policies and procedures that may or may not relate to certain staff members, I'm really just keeping to the basics for this presentation about standard precautions and encouraging everyone who is clinical or wants more information to thoroughly read the infection control manual. And I believe it should be pushed out to everyone on PolicyDoc to be reading anyways. So I'm just going to get right into it. So standard precautions are basically another way of saying the practices required to achieve a basic level of infection control at different facilities. So every healthcare facility is required to practice standard precautions and to ensure that they're following through on this and that we are making sure that we're doing it. So there's a couple different things that make up standard precautions, and we're going to go through some of these today. It's practicing good hand hygiene, wearing appropriate PPE, practicing respiratory or cough hygiene etiquette, knowing basic modes of transmission, properly handling and disinfecting equipment, following safe injection practices, handling contaminated equipment, and avoiding consuming food in clinical work areas. So I'm going to jump right to this, and that's practicing hand hygiene. And if you have never practiced hand hygiene before, I'd be really shocked. So in pre-COVID times, maybe people weren't doing this as much as they should have. But now people should be doing this fairly often. We are required to show you all how to wash your hands. Again, I'd be real shocked if some folks didn't know this, but that's okay. So as you can see here, if you choose to not wash your hands with soap and water and you do it and you wash your hands with hand sanitizer, it should be at least 60% alcohol. I've been hearing some news about certain hand sanitizer brands that were manufactured in, I think it's Mexico, that has the wrong type of alcohol or it's causing certain damage to folks. So you just have to keep an eye out on the certain brands. And I believe someone was supposed to send out information about that, about the particular brands in question that people should avoid using because it causes more harm. So it's really important when you're washing your hands to focus on your fingers, your palms, especially your fingernails. I think that gets overlooked quite a lot. Your wrist, your thumbs, and if you dry it, you rub it until it's dry, and then there you go, boom, it's clean. So obviously hand hygiene is an individual thing. We have to do our own part to ensure that we are maintaining basic infection control, and that really starts with your hands. So moving on to wearing appropriate PPE. So PPE stands for personal protective equipment. And it comes in different forms. So gowns, obviously making sure you're wearing it correctly. I know right now, because of the state of supply and inventory right now with our main PPE vendors, we're getting a lot of different donations of gowns and really lots of different PPE. And so some of the gowns look slightly different. So some are this sort of clear see-through ones. Those aren't necessarily our favorites, but we're going to keep those just in case the supply gets really bad. And then we have the green ones, which we got through Salesforce and UCSF. So they're not all going to look the same, but they all function exactly the same. So the other type of PPE are surgical or procedural masks or respirators like N95s or KN95s. There's the eye or face protection through glasses or face shields or goggles and gloves, obviously worn down to your wrist. If you've also never worn a mask before, I'd also be shocked by that, but that's okay. We're going to start from the beginning. So really important to clean your hands before you put on the mask. And so you hold it by the ear loops, or if yours doesn't have ear loops, the portion that sort of goes around your ears or to the back of your head. So pulling the bottom of the mask over your mouth, keyword over your mouth, and chin. So wearing it over your chin, not going to work. Wearing it over your mouth and your chin, but under your nose, also not going to work. It should be covering your nose, your mouth, and going about to under your chin. And if you have the ones that have like a stiff edge at the top, like you just pinch them to make sure it's sealed around your nose as much as possible. When you are wearing it, you avoid touching the front of it, and when you're done, you throw it into the trash. And real key step here is also to clean your hands with soap and water or hand sanitizer when you're done. So that is PPE. Let me just make sure I have the notes. Okay. So practicing respiratory hygiene, and this is for both staff as well as the things we also need to encourage to patients. And that is if they're coughing, that they're doing it into coughing or sneezing into a tissue or into their elbow if they're able to do that, but ideally into a piece of tissue, and then you dispose of it and then you wash your hands after. I know that that's particularly more relevant for our patients, and every clinic should have signage in your waiting room to encourage patients to cover their mouths when they're coughing or sneezing. Most of the clinics now are providing masks to patients when they enter the building. Aren't doing that, and so this is more like post-COVID world. We're mostly okay with this, with patients wearing masks, but we should also be doing some education and sharing of information to patients about proper hand hygiene, cough hygiene when they're not wearing their masks, especially like if they're at home or something like that. Moving on to the next slide. Oh, my computer is freezing. Okay, so so also part of standard precautions is just knowing the basics of the modes of transmission, and this is how disease can spread. And so there's really three main ones, and I'm going to also open this up to Dr. Rees if there's anything you want to chime in about, but there's contact, droplet, and airborne. So contact obviously through touch with patients or their environment. Droplet is through droplets formed by patients coughing, spitting, sneezing, speaking, or doing anything involving procedures around their mouth or nose. And propelled about 6 feet, and they tend to be larger droplets. And then there's the airborne transmission, which is the same mode, patients coughing, spitting, sneezing, but these are smaller particles, and they're able to be released into the air and carried throughout the air. Jaime, do you have anything to chime in about modes of transmission?
Not really, except that masks help prevent both airborne and droplet. If you're sick, you're covering your face and your mouth. So areas that you would produce these droplets and airborne sprays, so that protects. But there's some thought that wearing a mask is also protective of you from the external environment, even if it's not N95. So that's all I really have to say.
Okay, thank you. So there, in the infection control manual, there's pretty lengthy descriptions around the protocols for what patients, what to do if patients come in. Again, this was pre-COVID, for any patients that would come in with any suspected issues, and if they needed special precautions when they were in clinic. So I do recommend you still review that section. Things are a little bit different now with COVID, but that's okay. It's good for you just to know that knowledge to begin with. They also talk about a protocol for what to do if patients come in with bed bugs, which about 2 years ago, we had a lot of practice with that. So this is modes of transmission. And again, it's very, very basic information meant to for all staff, not just those who are clinical. Obviously, those of you who are medical or clinical have a lot more experience and knowledge about this. Okay, so moving on to properly handling and disinfecting equipment. So also a cornerstone of solid infection control. I have here some just basic definitions, really focusing on bloodborne pathogens, which are pathogenic microorganisms present in human and some non-human blood, or other modes, other PIMs, what that stands for. But what I want to bring to your attention is the difference decontaminating, which are really two different things. Cleaning here is defined as the removal of visible soil from a device or surface, using the action of scrubbing and cleaning. And then decontamination is the use of physical or chemical means to remove, inactivate, or destroy bloodborne pathogens. So really important to know that those are actually two different things. There's this sort of visible cleaning, and then there's the decontamination of sort of the things you can't really see on the surface. So those are two different processes. So basic cleaning expectations, again, across the board, really generic. Staff must wear gloves and masks minimally when decontaminating exam rooms or work areas, or other PPE as necessary. Again, in this now COVID world, that's slightly different. That's okay. These are pre-COVID protocols and that are generally mostly the same. So mask and gloves. All equipment and surfaces that come into contact with blood or other potentially infectious materials, OPIM, must be decontaminated with an appropriate disinfectant. What does that mean? Using Windex to clean an exam room table that had blood or mucus on it, not an appropriate disinfectant. So we all know and have access to the standing cloth wipes in clinic. That is an appropriate disinfectant. Again, current COVID world, our stock of wipes are a little bit different. You may not be ordering, you can't order the ones you're maybe used to getting, but generally the standing cloth wipes or the generic ones are really, really good for disinfectant. Exam rooms must be disinfected between use. So table paper replaced, discarded appropriately, surfaces wiped down. Staff must document on exam room cleaning and stocking checklist. I would say that this is probably one of the areas of infection control that we're doing the weakest on, is documenting the room cleaning. Some departments are doing better at this than others. But basically every single time the rooms are cleaned and really thoroughly deep cleaned, we have to be documenting this. There was one department that didn't document any of the cleaning for the whole month of, I think it was May or June. We know it probably happened, but it's not documented. And if it's not documented, it didn't happen. So really important that that is being documented, and the clinic managers or in charge nurses are making sure that they're collecting those forms from the exam rooms and providing sort of coaching to staff if they're not doing it, or kudos to staff who are doing it consistently. Really also to be mindful of the contact time of the decontaminant. So contact time is the amount of time the decontaminant must be left on the surface to actually work. It varies by product. It's anywhere between 1 to 2 minutes. I think I've seen some up to 5 minutes. So that means maybe you're wiping down the surface with a standing cloth wipe or a that's a decontaminant, and within 10 seconds you're touching the surface again. Well, enough time for it to do its work. So in order to see the contact time, it should be on every bottle or container. So you should look for that and again, know what it means, okay? And staff are not allowed to consume or store food products in exam rooms or other clinical areas where clinical work is performed, immunization room or medication room. So post-COVID world, for social distancing, we really want to make sure staff have enough space, comfortable space to eat. I know we've made exceptions to staff eating in shared work areas, and that's okay. I want to though encourage staff that you have to be cleaning your work areas You really shouldn't be storing food in like personal areas especially if they're unsealed. Not only is that potentially unsanitary, but we also don't want any critters into clinic. That would not be great to have to like close clinic because we have insects or furry critters in clinic. We want to avoid that. So disposal of infectious waste is also another cornerstone of infection control. So that is making sure that infectious waste, that is everything like lab waste, disposable used equipment, soiled wound dressings, or any sort of material that has blood or bodily fluids on it. So biohazard waste should be disposed of in the red disposable plastic bags. Keyword red. They should not be in the trash bags, which are the black bags. And the bag should be tear resistant, leak proof, and really secured to the hard plastic trash cans or whatever cans they are stored in. You don't want the bag kind of loosely tied around the plastic container, otherwise it could spill out to the bottom of the container, and that plastic container then has to be cleaned and disinfected. Okay, so emptying all full infectious waste containers, you have to wear gloves, make sure you twist the top of the bag closed, tie a knot, and then take it directly to the biohazard disposal room. Most of actually all of the biohazard waste containers are in a special leak-proof container. They have to be clearly marked, and they must be closed and sealed away from public areas. Most of the staff here should know where your biohazard bin is stored or kept. It's in a different place for each clinic. Speaking of sharps containers, so contaminated sharps or needles should be placed in a specific sharps container that's closable, puncture proof. We're not putting them in paper bags, they're in a hard plastic container. And biohazard sharps containers must be upright, and they should be located in like as close to possible to where you're going to be using them. You don't want to have it too far so that it requires you to walk far. That's not ideal. They should also be at eye level, and everyone has a different height. But the real key is that you should be able to look and see the top of it. If you have to like reach up to the biohazard, the sharps container, and you can't see what's potentially on top, that's problematic. And you should consult with your clinic manager or charge nurse to potentially have it adjusted so it's easy for folks to see. I think it was about 1.5 years ago, we did have a needle stick or a near miss where that person potentially wasn't able to see the top of the sharps container. And sharps containers should be checked daily, and when they're 3/4 of the way full, they have to be taken and disposed of in the biohazard room. Practicing safe injection practices, that's kind of dual. So when we started tracking incident reports really comprehensively about 2 years ago, we definitely have had 5 needle sticks or close calls in the last 2 years. That's cumulative, and they all for different various reasons. But in hospitals, there's about 385,000 needle sticks or other sharps injuries. Those about 27% occur with disposable syringes, which everyone in clinic uses fairly frequently. So safe handling, this is just, y'all already know this, but it's just make sure you're handling needles with gloves, never to recap or object. Keep your finger away from the needle tip. Try not to lose focus or get distracted. This was actually one of the reasons for a needle stick in the last 2 years, was that individuals were not focusing, or they were distracted by other things and they got pricked. Do not put your hands into a sharps container. Oh my God, please don't do that. This goes without reminding. And that sharps container should be at your eye level or below and within reach. And if a needle is sticking out of a container, please don't push it in with it. Please talk to a supervisor or some other clinical supervisor who can help with that situation. And if you find an uncovered needle outside of the container, make sure you wear gloves, and it is okay to pick it up on the non-sharp end. And if or you don't feel comfortable, pick it up with tongs and then put it into the sharps container. And so that presentation, but it's really, I want to thank everyone for doing your part to ensure that we are working in a safe work environment. And please, please, please review the entire infection control manual in policy tech. I believe it's required now for onboarding medical staff to read it when they start. And if you have any questions about procedures that you read in the infection control manual, please speak to your direct supervisor first. And then those supervisors can consult with the lead physicians or me in clinical operations around certain protocols and how they may apply or don't apply to your team. Okay, so I'm gonna stop my share now. So does anyone have any questions? Oh, there are some. Okay, so Fernando is asking, what about bloodborne transmission? What about it, Fernando? Can you expand on that? I can't hear you. Let me unmute.
You answered it already. I got to answer myself.
Okay, okay, great. Cool. Let me mute you again. Okay, so someone else asks, masks with the filters around filter are questionable in providing enough protection when COVID exposure in clinical settings. Adding face shields improves effective. And that's from Maria. I have heard that as well, that some of the filters that are being sold on a mask are actually sort of pointless, and it's more about style than substance. So I would second that masks with filters are questionable, but Jaime, have you heard of anything about like cloth or surgical?
Well, no, I mean, it just still to go back, masks are same basically. Surgical or disposable, don't need to be cleaned. Cloth masks need to be cleaned routinely. They're mostly preventing you from spreading disease, but some research does show that it protects you, whether they're cloth or surgical masks. The only difference between the two masks would be N95, and even an N95, just having one doesn't protect you. You need to have it fitted to your face so that there's no air going around it. So it has to be fitted. Just buying one at the store and not knowing how to use it doesn't help you. And finally, regarding N95, you have to change it between every high-risk interaction. So people who were panicked at the beginning and wanted one to wear the whole day, well, that wasn't going to help them at all. It's really meant to be changed between really high-risk interaction. So you can imagine the people out in the testing tents. They need to change between each patient or between high-risk interactions so that they have a fresh, clean one on when they're doing that again.
Okay, thank you. And Maria had another suggestion. She asked, can our in-home spray disinfectant be labeled per contact? Asking about spray bottles, we have some just contain diluted bleach. Due to shortage, MNHC had to make some of their own. I don't really understand that. I mean, you said that to me privately. I apologize for reading that out loud. We can talk about it offline if you want, or you can ask me now. I think we have some concerns. Okay. So any questions about infection control? And again, any questions or any comments, you can unmute yourself or you can chat it into the chat box. No questions? Are people pondering, thinking about this? Okay. All right. Well, thank you for everyone's time. And then I will make Joni the host again. Oh, Joni, I think you're under Brenda. Are you under Brenda's account?
Oh, here I am. Yeah, I am.
Oh, okay.
Just a reminder that you need to take the quiz. And Stephanie, I'm not sure if you wanted to submit a quiz as well, but it's not necessary if you don't think so. But take the quiz. It's an acknowledgement that you were at this training, and the recording will be made available probably tomorrow, and we'll send out a link. And I think that's it. I want to thank you all for participating in this new way of doing all staff meetings. So thank you very much. And I think that's it.
Thank you, everybody.
Bye. Thank you, you all. I didn't even stop.